Hey friends, my name is Brandon Morrow. I get to serve as the lead pastor of Good News. We love the relationship that we have with Crossroads as well. And so this video is for both Good News and Crossroads. And I'm joined by one of our elders, Dr. Steve Vander, and he is a doctor of osteopathic medicine in Spirit Lake and also happens to be the senior most and most experienced and I think maybe the only medical professional on our leadership team. So what we're going to do is we're just going to give you a short update on our COVID-19 plans. Recently, we released something that was a 4-phased plan. And so phase 1 was just online-only gatherings. And then phase 2 was online plus smaller gatherings. So we're going to define smaller gatherings, and then we're going to kind of just tell you what we're moving towards, give you some extra guidelines, and answer some questions that you might have. And so kind of the space that we're moving towards now in the smaller gatherings is Celebrate Recovery, missional communities, and for Crossroads, life groups. And so as we get into these new environments, we want us to continue to do great, meaningful multiplication work. We want us to shepherd our community. But we're going to do some experimental type things. We're going to be evaluating kind of the processes of understanding what is going on with Celebrate Recovery. How do our participants in our missional communities and life groups feel? And how can we tweak and make these processes better and safer for our greater community? So for example, next week on June 9th, Celebrate Recovery is beginning here in this building, and they're going to have some increased safety guidelines and some considerations. Jay and Shelly Birdsall have put this together. They've been working with their team. It'll be great. All of that information will be available online. It'll be available also on social media and an email communication form, so you shouldn't miss it. With that being said, with that, we're going to also jump into missional community life. And so we've kind of outlined some just different cleanliness and safety guidelines. And so Steve is going to help us talk about best practices for groups meeting in homes. And so we're going to talk about hand hygiene and social distancing. And we're going to talk about what on earth do I do with my children who don't understand how to socially distance. And we're also going to talk about what are some outside options. So Steve, I want to just ask a couple questions, kick it back to you. Can you talk to us a little bit about, as our groups are getting towards gathering, what are some good practices for hand hygiene? What do hosts need to do?
Yeah, I think for hosts in their homes, just cleaning before people come, cleaning the hard surfaces, doorknobs, countertops, being able to have people wash their hands when they get there, and then when they leave as well, and then when people leave to clean off those surfaces that were touched. And then also maybe taking off shoes before you come into the house, just so that they're not tracking in other things there.
That's good. That's good. So what are some social distancing things that we need to think about as we're in people's homes? Is there something that we need to think about in terms of cleanliness and safety, door handles? What do we do if we're singing? Maybe it's a missional community karaoke night. What do we do?
I think still trying to maintain social distancing, so 6 feet apart, which when you're meeting together becomes very hard. Naturally, we want to be close. So trying to practice the 6 feet of distancing. If singing, probably more 8 to 10 feet. And if you're not able to maintain 6 feet of distance, then maybe trying to wear a mask if possible, if you're willing, just to try to decrease any spread between persons.
Are there any guidelines for alcohol-based sanitation for hard surfaces or anything like that?
I think for hand, like if you can't wash your hands with soap and water, to use hand sanitizer with at least a 60% alcohol content. I haven't seen if there's anything official on surfaces, but probably, a Lysol if you can find it, or a bleach concentration, which there are some recipes for that on the WHO website. So using something that actually kills viruses.
That's good. And we just want to make sure that we're using different things like this to make sure that if we are inviting people into our home, that it's a safe space, not just for our families, but also for people coming into our home, and they're going to go out elsewhere and they're going to take those things with them. So we want to make sure that we're caring for our community. Okay. So I have 3 young boys who don't believe in social distancing measures. What should I do?
Yeah. I think depending on what group you're in, there's different ages and stuff. So I think if it's possible to meet men and women different times so that the other spouse or partner can watch the kids at home and not bring the kids there. and or if you can meet outside in a garage. That's still hard with kids to keep them contained, but I think everybody has a different level of need at this time. So just trying to know that kids aren't going to isolate. So how do you best protect them and the people that they're going to be around?
That's good. That's good. So there's a big question about older adults and a group of people who is at a higher, I guess, a greater likelihood of maybe contracting a virus or some form of infection. What would we say to an older group of people who doesn't have children and is maybe trying to navigate some of these socially isolated and distance measures? What would you say to them?
Yeah, and I think part of the people we're talking about are more likely to have complications if they get it rather than just getting it, more likely to get it.
No, and what is there an age range on that? We've all seen different reports on susceptibility, ages, and rates, and there's a lot of statistics out there, tons and tons and tons. At what rate or what age or what, is there a certain criteria, a list of items that people with these considerations need to be cautious of?
Yeah, I think we want people who are higher risk, which, the official guidelines recommend if you're over 60 or 65 to maybe limit your activity outside of your house. If you have other pre-existing medical conditions like high blood pressure or diabetes, lung conditions, then trying to just maintain some level of caution. Obviously, we know some of those people are at greatest need for any interaction too. So, if you're doing fine on Zoom, keep doing that. If you need a live meeting, to do that, but do it safely. And so, I hate to dictate what people can or can't do, but just trying to make sure we do it safely.
That's good. So one of the questions I think a lot of people have been wondering, like, hey, why is it taking so long to getting back to in-person worship gatherings at Good News and Crossroads? And I guess the question is, why are we being so cautious?
I think the first part of that is just out of love. Like, we don't want to be a source of transmission. So it just takes one person who's infected that may or may not even know they've been sick to then spread it to lots of people. And so if we have lots of people together, that risk is just higher. So I think just out of love, trying to limit the risk of exposure, but also meeting needs in that. So I think this is a true public health threat. Thankfully we haven't had the big surge being in a rural area like some of the bigger cities. But as we have more people here this summer, as some of the other restrictions have lightened up, thankfully, we don't know what that risk is going to be. So until we know more of how things are going to play out later this summer, we just want to be careful.
Yeah. And so we're dictated as kind of one of the values of our church is that we want to pursue transformation of the whole person. So it's not just soul or mind, but it's also the body, it's also the community, it's also the people who are around us. And so we are wanting to practice behavior that's pastoral in nature. And we don't mean like clergy, wear a white collar, have to go to seminary. I think everybody should. But I do think pastorally means to shepherd the most vulnerable in our community. And just as you said, just because you're not in the most vulnerable category doesn't mean that you're not going to come across somebody who either works with the most vulnerable, has the most vulnerable family, or maybe has an underlying health condition that they know absolutely nothing about. I think there's a weird thing that's usually how health scares happen. We didn't know about them in the first place. And so you can help us, and Steve has been a big part of this as he serves on our COVID-19 response team as well. You can help us and our leadership team make great decisions, and you can also help us join Jesus in his work of renewal by just following these great guidelines. And so we've got step-by-step processes and procedures and helpful tips and tricks on our website, gncconline.com/COVID-plan, that you can read more about. You can use these in your home as you are hosting gatherings, and you can certainly be a part of the work of making disciples. So, Steve, thank you so much for giving your expertise and your shepherding heart for our congregation. We're thankful for the work that you do in our community.
My pleasure. Thank you for everything you do too.